So early detection. So right now, the radiology group recommends that you should get your mammogram starting at the age of 40 and annually thereafter.
Okay.
If you are high risk, meaning you have a strong family history of breast cancer, then that's when we look into getting them done sooner. But otherwise, for the average woman, 40 years of age.
Gotcha. Now, I've talked a little bit with why I run a 5K each year, and it's because a couple of years ago I had a scare, and I'm in my 30s. I never in a million years thought this was anything I needed to worry about. So I actually get mammograms every year now, and a lot of the reason I do it is for peace of mind, because if you feel something funny, you don't know what it is, right? Turns out it was
Right.
nothing.
Yeah, yeah.
But I always do it every year because they were saying they like to be able to see if there's any changes
Sure.
with
Yes.
each year. So obviously we want to talk about teaming up with you all. USA Health, Cumulus Mobile has teamed up with you all. And yeah, I know you guys have a great center for this kind of thing.
Yeah, so I see patients at Strata. That's adjacent to the Mitchell Cancer Institute, as well as Children's and Women's Hospital, which is where I operate. At Strata, one thing I do want to let people know is we're taking every precaution when it comes to COVID-19. Every patient, staff member that comes in, you're getting a screening process that includes taking your temperature. Everybody's wearing masks. I'm not right now, but it's because I'm in an office completely by myself. And, we're sanitizing the rooms between each patient counter. So I want, first and foremost, everybody to feel safe. Don't delay getting your mammogram because of COVID-19. Secondly, one thing I would like to highlight is if you come to Strata to get your mammogram, we provide same-day results. What I mean by that is you get your mammogram, and whenever you leave here, you will know whether it looks normal or abnormal. You're not going home and getting a call back. That's unique to this region. That is a service that only we provide. Number two, if it is abnormal, we will go ahead and do your diagnostic workup, a biopsy, and you'll have a surgery consultation all within that same visit, which is huge. I mean, we're talking about expediting patient access to their treatment plan, decreasing their wait time. Up to 21 days sooner, they'll start treatment for their cancer.
Sometimes it usually take 2 days and wait for a phone call, and you're sitting there going, "Okay, God, she doesn't call."
That's right.
That's
right.
Does it mean something if they haven't called yet? Yeah.
Right. This is great.
Right, and it's so anxiety provoking. All of this process is so it just makes you anxious, and so the fact that you can have answers that quickly, I think, just helps with that process as well. So.
Yeah, I mean, it's better to, it's all about early detection.
That's
I know
true.
we keep pushing that, but it really is. I mean, the amount of people, wow, I felt something, but, didn't think anything of it. I mean, it's really important to do something about it if you do that, or just, like I did, peace of mind,
Yeah,
absolutely. The earlier you can find it, the better, because smaller cancers are much easier to treat, better prognosis. Patients that are delaying or putting off their mammograms for years oftentimes will present to us at a later stage whenever they do have cancer. So meaning the primary tumor is a larger size, or it's already spread and they have metastatic disease. So, the earlier the better. Nobody likes to find something, but at the end of the day, we'd rather find something when it's small and we can deal with it, much easier. So.
Yeah. And Breast Cancer Awareness Month, I mean, every October, just, a reminder. I'm so excited to be partnered with you all. We really appreciate, our partnership, and, we're getting the word out so, we can get rid of it, right?
Absolutely. Yep.